The AANA is pleased to present the Wellness and Chemical Dependency in the Nurse Anesthesia Profession curriculum to increase awareness and knowledge of the need for each of you to be healthy and well. Many of you are viewing this curriculum as nurse anesthesia students. We're excited to have you begin this fulfilling profession. We believe it is imperative that you learn about occupational risk for addiction at this early stage of your anesthesia education. Equally important is for you to discover the need to adopt and employ healthy lifestyle behaviors throughout your professional tenure. Some of you are further into your careers and may personally know colleagues who have suffered the consequences of turning to unhealthy habits, such as drugs or alcohol, to cope with personal or professional stress. Whatever your career stage, professional lifestyles that promote effective coping, adaptation, and resilience can be taught, learned, and adopted. These modules provide a number of simple but essential elements to forge a long and healthy career. The overarching goal is to create a healthier workforce and, as a consequence, to optimize patient safety. The curriculum is presented in 6 modules. Each can be viewed independently by the learner at any time. Module 1 and 2 introduces general concepts and the dimensions of wellness, the threat of stress, and the need for resilience. Module 2 explores specific stress research data from the CRNA and student nurse anesthetist populations. Module 3 expands on these concepts, addressing specific healthcare stressors, and introduces the risks for chemical dependency and addiction. Module 4 imparts a broad overview of the disease of addiction, along with the signs and behaviors to recognize an impaired colleague. It also presents an introduction to understanding of mental health conditions, such as burnout and depression, and the impact of these on overall well-being. Module 5 speaks further to the consequences of the disease of addiction, introduces treatment and recovery, explores the challenge of potential reentry to the profession, as well as relapse. Module 6 highlights the concepts from the first 5 modules and offers resources for creating and sustaining a personal wellness plan. We hope that this curriculum introduces each of you to the concept of building your personal wellness arsenal of coping skills and resiliency strategies. The learning will facilitate the development of a healthy approach to stress reduction throughout your life. Finally, it will focus on the elements of sustaining healthy relationships, diet, exercise, and carving out adequate time for recreation as well as sleep and restoration. With knowledge as power, we envision that the increased awareness brought about by engaging with this module series will help reduce the incidence of substance abuse by CRNAs and student nurse anesthetists. It is further hoped that this knowledge may also prevent the threat of untimely death related to substance abuse in the anesthesia provider population. An impaired provider poses great threat not only to themselves, but also to the patients in their care. We encourage nurse anesthesia educational programs to advance wellness and chemical dependency education during the student orientation and inculcate these principles throughout the program. The goal is to strengthen knowledge and coping skills and proactively seek balance to avoid professional and personal vulnerabilities. The AANA thanks the Curriculum Task Force volunteers who contribute to the content of these modules.
Module 6, Understanding the Environment for Successful Building and Sustaining of a Personal Wellness Plan. This module will assist in analyzing one's environment and how to build a sustainable personal wellness plan. The purpose of presenting Module 6 is to provide a means of understanding the anesthesia environment and assist students, faculty, clinicians, researchers, managers, and families in anesthesia in developing a wellness plan. These objectives discuss the analysis of the environment, personal characteristics, strategies, and planning for changes in the environment to promote positive changes for personal wellness.
Program directors, or PDs, and all faculty have a responsibility to the students, the program, and the profession to develop policies to incorporate wellness and stress reduction in their programs. These learning modules hopefully will provide awareness and tools to help and support their CRNAs and students during a crisis. For example, to assist with suspected drug abuse or addiction, Faculty and PDs can call the State Peer Assistance Advisor for help with contacting the State Board of Nursing and the nearest treatment center specializing in healthcare professionals. To find peer assistance in your state, go to www.aanapeerassistance.com and follow the link to Getting Help. An additional resource is the book by CRNA Bernadette Roche, Substance Abuse Policies for Anesthesia, which provides an excellent resource for developing policy in both programs and work settings to address these issues. Information for ordering Dr. Roche's book can also be found on the AANA website. CRNAs and students need to be aware of physical and mental pre-existing issues that may affect their ability to successfully enter and survive in the profession. The nurse anesthesia professional is at risk for significant stress. Further, access to pharmaceuticals that we believe we know how to use and control may predispose individuals to the risk of chemical dependency and addiction. Additionally, some individuals may be at risk due to inherited or genetic traits. Introspection and self-awareness are critical factors in managing wellness. By understanding your risks and vulnerabilities, you are able to avoid problematic life events that lead to unhealthy lifestyles, as well as assist in building resilience to using unhealthy coping mechanisms such as drugs and alcohol and the disease of addiction. Research has shown us that self-assessment, reflection, and change may help us each to stay on a course of wellness. Research and theory in cognition indicates that automatic responses may be displayed without awareness, but controlled responses require effort and conscious intent. Therefore, frequent self-assessment is necessary. The goal of self-assessment is to identify problematic tendencies and habits. These may range from inappropriate behaviors such as anger or overeating to drug and alcohol abuse. Each of these upset the balance of a healthy lifestyle. Assessment allows objective awareness of needs to reach for balance. The acknowledgement of the problem is the most difficult step in changing undesirable habits, and there is always a strong tendency toward ambivalence and a self-serving bias toward suggested need for a change in behavior. Permanently changing behaviors and habits requires significant self-reflection and mapping our emotions. Self-reflection is the beginning of training ourselves to accurately discern our state of being. Psychological diseases are long-term, and assessment assists in the need to understand our thoughts and behaviors. The emotional repercussions of any addiction can be long-lasting and devastating for all family members. Multiple factors are involved in the decision process when determining to seek assistance to initiate a change of behavior and to overcome any addiction. Self-care is a change process to developing healthy habits. Based on change theories of cognitive behavior, reason, action, and cultural relations, people change voluntarily only when A. they become interested and concerned about the need for change, B. they become convinced the change is in their best interest or will benefit them more than cost them, C. they organize a plan of action that they are committed to implementing, and D. they take the actions necessary to make the change and sustain the change. To initiate a change, first, a person must believe that the benefits of performing the behavior outweigh the cost. That is, a person should have more positive than negative outcome expectancies. Second, and perhaps most important, the person must have a sense of personal agency or self-efficacy with respect to performing the preventive behavior. Third, he or she must believe that they have the skills and abilities necessary for performing the behavior under a variety of circumstances. Successful life changes begin with a stepwise approach. The transitional models that are necessary to initiate change are described in the steps listed here. In order to make personal changes, it is necessary to identify critical dimensions that seem to impact behavioral change. It matters that one engages in each of the transitions to complete the change process. Engaging in these processes leads one through the cognitive and behavioral process of change, through the context of change, and finally to the markers of change. It is necessary to complete each of the stages to progress to the next. While these offer guidelines for change, there may be other issues or resources in various areas of life that would help or hinder engaging in the processes and completing the tasks of change. Making good changes for wellness requires good decisions. The Decisional Balance Inventory described by Collins, Carey, and Otto in 2009 consists of two constructs that address cognitive and motivational aspects of human decision-making. Thinking about the cost and benefits of changing a behavior and determining what is involved in a decision to change habits is crucial to successful change. Weighing the pros and cons of changing something is an ongoing process and happens all the time. Many times, the decision to proceed is based on motivation. Lastly, it is important to understand your motivations to make change permanent through internalizing the event. More on the decisional balance learning process can be found online at www.motivatehealthyhabits.com. Sometimes past failures to change set the course and motivation for new changes. If previous unsuccessful attempts at completing New Year's resolutions, attempted weight loss, or attempted smoking cessation are ingrained in one's psyche, motivation for future successful attempts is difficult. Setting small, achievable goals, taking an inventory of continued successes, and enlisting the help of others increases the chances of positive changes. Constant reevaluation and readjustment of the process is key to breaking down barriers of change and can lead to positive results. Let's also look at the stages of change. The process of change and how individuals change offers a developmental, task-oriented, learning-based view that can be used by individuals, clinicians, and researchers using a variety of traditional etiological and cessation models. During pre-contemplation, there is typically no intention of changing behavior, and because it's not associated directly with any changes, it often escapes one's awareness. When someone begins to contemplate making a change, they generally intend to take action within 6 months. During preparation, many are making plans and developing strategies to take action within the next month. Taking steps toward making the change is the action stage. This can be observed as an outward action or attempt at changing the behavior. The maintenance stage occurs when behavior changes have been successful for 6 months. The ongoing process of maintaining the change is the terminal stage. Any process to treat and manage an addictive behavior must have an intentional commitment to change. Personal values, family influences, and facing denial and major life events are critical in the individual's consideration of making change and affects motivation as well. Consequences can influence one's readiness, but first the individual must experience the ultimate understanding or cognitive recognition for the need to change. This recognition can be prompted by an overdose, suicide attempt, being overweight, anger incidents, or hitting bottom. Motivational focus clarifies values and finds meaningful life goals, which in turn provides a vision of goals that are possible and realistic. Ambivalence is normal and can hinder progression to wellness. Ambivalence will be constantly reemerging and cycling throughout all stages of change, and is sometimes the fear of being successful or an unwillingness to make the changes. It is important to remember that if you are successful, you were motivated, and if motivated, you will become successful in change. Most people are motivated at some level. They are motivated to just engage in preliminary behaviors that initiate change, while others may still be motivated to consider harmful and problematic behaviors. It is important to become and remain motivated for successful wellness behaviors and those that will be productive and helpful. People who seem to have everything to gain from changing a behavior are not always motivated to do the things necessary to make changes. Therefore, a blend of social forces, selecting values and goals, may support or direct one toward the process model and the readiness to change. DiClementi in 2003 describes how motivation works in different models. The process model provides a comprehensive approach to motivation. It blends all the previous models and seems the most salient and desirable. Here are some ways in which you can use motivation to improve your wellness. Affirm your strengths and recognize your faults. Surround yourself with positive relationships and work to improve weaknesses. Listen to your inner voice and keep a diary or log to track changes and make adjustments. Take time for well-thought-out choices, as those made in less stressful environments usually provide the best results. Careful planning and preparation provides good outcomes and reduces unreasonable demands. Accept that you can always make improvements in performance. Work towards reasonable expectations, goals, and outcomes in professional life. We've mentioned the health benefits of pets throughout the modules, and surprisingly, another is the benefit to decision-making by the relaxing environment and relationship that owning a pet provides. Become aware of what effect your behaviors have on others around you. One can contribute and change the environment in which you reside, and being aware of the fact that you can change that environment is important to supporting personal motivation. Challenge your mind. Balance in the professional arena is achieved through prioritization, so volunteer and give back to the community. Take time to enjoy a relaxing activity. Family and friends provide a great support network throughout one's life. Don't forget to return that support and enjoy close family relationships. Resilience is emerging as a major influence of coping with stress, and laughter provides one outlet for stress. Be willing to laugh at yourself. Personal beliefs and attitudes will help adjust to the stressors you experience. Through contemplative evaluation and examination of the stress in your life, you can categorize and realign your response to stressors. Include family and friends in your preparation for life changes, which helps you reduce stress and provides a resource to find other solutions. Removing the simple stressors and barriers to good health are sometimes the easiest way to begin the process of a productive change. Take the time to reflect on and appreciate all of the people you know and the things you have. Constant practice and reevaluation is necessary to stay abreast of a busy schedule and for making continuous changes in life. Taking action to employ simple strategies which evaluate the relationship between personal and professional life allows for a reassessment and readjustment of the balance between the two. Constant work and therefore constant fatigue is one of the first steps to developing unhealthy behaviors. Reducing the work commitment and getting more rest is essential to a productive life. More work time to live a better lifestyle leads to less family time and many times more financial commitment. More work time can also lead to ignoring the family and support network in your life. We also take our work home with us and have little time to rest and relax. As a professional takes on more work, there is more responsibility and work assigned, increasing expectations and stress. Nurse and anesthetist are on call and work a lot of hours without rest. Limit the time at work to a reasonable level to allow for other more relaxing activities. In a stressful professional life, family and personal networks are important to provide support. As work commitments grow, family expectations decrease, many times leading to a breakdown in communications, more challenges, and additional stress. In order to cope with change, we must be able to remain dynamic and initiate personal and professional change as needed to accommodate the events. Permanently changing habits and behaviors requires self-reflection, motivation, adaptation, and personal mastery. Positive coping skills, personal growth, and supportive relationships are essential components of personal wellness. A single-minded devotion to career is impoverishing and can be unhealthy. By neglecting restorative activities, we tend to lose emotional resilience. It is necessary to establish time for rest, revitalization, exploration, and emotion, as well as intellectual growth. Share your talents with others by participating in community organizations and events. Develop a sense of community. Before you can learn to take care of others effectively, you need to learn to take care of yourself and build your physical reserves. Physical stamina is important to maintain healthy mind, body, and spirit. Create your plan for a healthy lifestyle that includes rest, a healthy diet, regular exercise, and avoidance of chemicals and drugs. Ensure that your personal plan includes activities you enjoy, like yoga, taking a short walk, going to the gym, or playing sports. Leisure physical activities are important for mental rest and relaxation as well. Activities that are away from work allow you to rejuvenate and refresh. Treating diabetes or hypertension or other physical diseases is an important part of caring for yourself and also recognizing self-worth. Essentially, take the initial steps to build your physical reserves and avoid those that sap your energy, such as stress. Modules 2 and 3 drill down to basic understanding of stress and its accumulated effects on nurse anesthesia professionals. In summary, stress is an everyday occurrence, and while some stress is healthy, many times it can become overwhelming and lead to unhealthy behaviors or ways of coping, such as alcohol and drug abuse. Stress from high demands in clinical practice or the academic setting is common. Personal relationships and professional relationships can be strained and sometimes difficult in the operating room environment. Student loans and other financial strains while in school are extremely stressful. Important life events like raising children, providing them with education, and family illness all provide potential areas for additional stress. Managing stress is a proactive, ongoing process and necessary to keep headed in the right direction on the wellness continuum to achieve a vital, meaningful life. Managing stress can be dissected into the following strategies. The long-term solution is to reduce the reactive strategies and become more enactive. Regardless of the type of negative or addictive behavior, cognitive therapy is often part of the solution. Cognitive behavioral therapy generally consists of a collection of strategies intended to enhance self-control. Examples include improving the understanding of behaviors that influence affect and emotional awareness, and restructuring perceptions to reduce negative or distorted thinking. The therapy accentuates the positive by increasing adaptive behaviors that are rewarding and benefit self-efficacy. When negative behaviors are decreased, often friends and family are better able to provide support. In treating addiction, specific techniques include exploring the positive and negative consequences of continued use of chemicals, self-monitoring to recognize drug cravings early in the recovery process, and identifying high-risk situations. Furthermore, developing strategies for coping with and avoiding high-risk situations and the desire to use drugs is one of the final steps of the process. Whatever the targeted behavior that is slated for change, one central element is anticipating likely problems and developing effective coping strategies. Cognitive behavioral therapy also teaches one to relax and take a deep breath when in a stressful situation. This allows one to slow down and think through a response or coping mechanism to address the stressful situation. Hypnotherapy, behavioral modification, transcendental meditation, and many other methods of relaxation also provide a guide for coping with stress. Medication offers an alternative when monitored and prescribed by a physician for short-term treatment of stress and anxiety. Healthcare providers must be careful when taking medications and providing any patient care. Unhealthy behaviors do not spring up overnight. They occur over time, usually starting with one poor coping strategy, which leads to other poor strategies. Maladaptive behaviors arise from the inability to effectively cope with stress. Therefore, it is important to find healthy alternatives to manage stress. Not surprisingly, change is one of the biggest sources of stress, and it is important to remain adaptive. If one needs to change more than one behavior, focus on only one behavior at a time to minimize your stress. Coping with one change will be easier than trying to cope with several at one time. Organized living space provides a certain order that makes it easy to find the things you need both at home and in the work setting. Preparing and planning for events, also known as building margin, described in Module 2, reduces the stress of everyday life rather than procrastinating and waiting until the last minute. There are some who function in a busy workplace setting and are able to cope with the stressful environment. However, mistakes become more prevalent when one becomes overwhelmed with such busy environments. Mindfulness is paying attention to the moment without judgment. Using mindfulness-based stress reduction, MBSR, gives a conscious and purposeful direction to our present thoughts and actions. By being mindful, it slows down the thinking process and allows digestion of the information. When we function normally, we may be thinking about a multitude of things going on around us. With mindful reflection, we focus on one thing and become aware of how it is affecting us and how we affect those around us. With mindful thinking, we look at things in the present without emotion or judgment, creating an interpretation that is better thought through. The use of mindfulness provides us with a number of immediate and long-term advantages listed here. When integrated into inpatient and intensive outpatient addiction treatment programs, mindful reflection evidence indicates improved rates of recovery without relapse. Mindfulness meditation practices, along with cognitive behavioral strategies, help to support clients and promote vital lifestyle modifications for a healthy life of recovery. Overall, MBSR teaches effective skills to reduce stress, manage urges and cravings, and cultivate compassion and acceptance. Stressors can be managed with good strategies and over time by removing yourself from a stressful environment or eliminating the stressors. Reducing the number of stressors, exposure times, and sometimes the stressor itself can provide helpful changes in the damaging effects of stress. Devote more time to yourself by taking breaks, vacation, leave, and days off in order to give yourself relief from the stressors you encounter. Know that you can't please everyone all the time. As a professional, you are expected to make critical and rational decisions. Therefore, the expectation is that you will do what is best for the patient to the best of your knowledge, and that may be in direct conflict with those around you. Do not fear some conflict. On the other hand, do not become so controversial that you are not able to communicate with anyone. By using mindful reflection, you can reduce the intensity of your emotional reaction by analyzing what the issue means in the present. Taking time to reflect on the now and its relevance to you and your resulting decision allows you to put things into a different perspective. Developing resilience is yet another method towards developing wellness. Resilience is a continued and positive behavioral change that occurs by doing those things that reduce stress levels and add to your positive responses. Being resilient does not mean you won't experience difficulty or stress. It does, however, give you a mechanism for facing the daily sources of stress which lead to dysfunctional behaviors. Having resilience means that in dealing with inordinate life demands, you will cope better. When an adverse situation cannot be resolved, you will be able to accept it and continue living with it more competently and with less emotional pain. Becoming resilient reduces inappropriate emotional responses and is a process for developing positive emotional responses. Resilience is needed in each of the 7 dimensions of wellness. Some additional disruptions that prevent resilience are procrastination, chronic rushing in at the last minute, running late, being intellectually unprepared, overcommitment of time and talent, and poor boundaries with family and/or colleagues. Lack of a spiritual connection or a calm, peaceful environment also hinders resilience. Critical and adversarial relationships, as well as imbalanced sleep, unresolved anger and resentment, unnecessary clutter, overconsumption of caffeine, fat, sugar, and carbohydrates, and excessive alcohol and drug abuse also lead one to lose resilience. The road to well-being requires resilience and is a personal journey. Everyone's journey to wellness is unique, and what works for one may not work for another. There are some general and personal protective behaviors in which you can learn to become resilient. These behaviors start in childhood and develop through social interactions, introspection, personal and environmental influences, and observations. Some general behaviors that will help one support resilience and well-being begin early in life and are seen in our natural dispositions or temperaments. These can be enhanced by self-reflections and learning. Seeking support from family and friends can be very helpful when developing life goals and your life's purpose. What is it that you want to accomplish during your lifetime? Supportive relationships and constructive role models help you learn and grow from your experiences, as well as create positive behaviors and emotions. Cognitive competencies, or your average intelligence, plays a role in your individual resilience. Self-efficacy and self-concept should be positive and realistic. Self-assessment is good if not carried to the extreme, as being too critical can be detrimental. Take a proactive role in situations that involve conflict instead of exuding more of a reactive coping behavior. This can give you confidence that can be built on for the next situation involving disagreement. Meaningfulness and structure in one's development early in life helps define who we are and creates positive lifelong patterns. Realistic future planning at work and at home creates a balanced life with both ups and downs. Some personal behaviors that one can work on include believing in your ability to reach the goals you have set for yourself. In order to be successful at achieving your goal, you must believe in yourself. There will be some who are pessimistic and others who will believe in what you are doing. The resilient individual will bond with those who support what they are doing and find comfort in taking the next step. It is these positive relationships that will be supportive throughout your life. These bonding relationships grow and create an experience of success, leading to positive feelings. And again, don't forget to laugh. Laughter releases endorphins, creating positive emotions. Building and maintaining resilience is an ongoing process and takes some work. Here we summarize some basic and easy steps to maintaining personal resilience. Each of us has our own unique stressors and red flags. It is important to recognize when you are on track and when there is a problem. Constant self-reflection and introspection allows us to know our limitations and areas of needed growth. Evaluation also helps identify problem areas that need improvement, while planning ahead and building margins develops good coping skills to become a habit when dealing with future negative crises. Staying well requires some work and is not a passive activity. Avoid unhealthy behaviors, and as an alternative, practice healthy behaviors like exercise or meditation. Consider ways that you can build and maintain your physical reserves. One idea is finding partners for physical activities, which can be fun and challenging too. Creating relationships for friendly competitions is rewarding and makes physical activity seem effortless and has social wellness benefits too. Conversely, be aware that physical exhaustion can be a predecessor to dysfunctional behaviors and irrational thought. Too much overtime or working more than one job can drain you of some or all of your physical capacities. Limit the time and amount of work you do, both on the job and at home. Creating realistic goals can help preserve the amount of physical activity one expends in life. The ability to think clearly has been linked to good physical stamina through exercise. Daily physical activity of approximately 15 to 20 minutes has been shown to be extremely effective in improving physical conditioning and professional fitness for duty. Consuming balanced and healthy foods leads to maintaining proper weight and physiology. Adequate diets give the energy necessary to meet stressful work schedules that demand clear thought and sometimes hard work. By participating in healthful activities, seeing your physician on a regular basis, and taking appropriate prescribed medications, you can help maintain good health and increase physical stamina. Not only is physical stamina important, but one's emotional stamina is equally important. Emotional stamina must be developed over time and sometimes with help. Creating achievable and realistic goals for your life prevents frustration and failure. Try not to exceed your limit and seek support when necessary to lessen the load. Creating lasting relationships is a long-term plan to building a supportive network of friends and relatives. Having others to help you through difficult times is essential to the physical, emotional, and social wellness dimensions. As healthcare professionals, we know how to care for patients, but often need to be reminded to extend our skills inward to be kind and gentle with ourselves as well. We all know that there are many common sense self-care behaviors that contribute to general well-being, and here we've summarized the basics. Be physically active, choose a healthy diet, maintain a healthy body weight, manage stress effectively, avoid tobacco and drug use, limit alcohol consumption, and protect yourself from disease and injury. Unfortunately, many fall prey to poor behaviors and unhealthy habits because of family, economic, and scheduling demands, and fail to either recognize the issues or take any positive action. Self-care is an important aspect of overall wellness. It includes a range of self-awareness practices that involve maintaining balance and building resilience. Self-awareness means having a deep understanding of one's emotions, strengths, weaknesses, needs, and drives. People with strong self-awareness are neither overly critical nor unrealistically hopeful. Rather, they are honest with themselves and with others. Think, no man is an island. Accepting help is key to improving and changing poor behaviors. We all need help from time to time, so don't be afraid to reach out to others. It is not a sign of weakness, but rather a sign of self-actualization. Family, friends, clergy, counselors, formal and informal groups provide a number of avenues to reach out for help and should be readily used. Experience also provides a good learning opportunity. However, you must be careful that this does not put you at risk for poor outcomes. Seeking professional counseling and psychological assistance may help sort out issues that seem to be confusing, difficult, or unmanageable. Moving beyond these issues allows personal growth and wellness. There are a number of positive effects that people can induce when supporting changing behaviors. Whether formal or informal support, individuals, self-help or peer support groups, and professionals can assist in removing barriers and providing resources to those contemplating, initiating, and maintaining improved health and wellness. Professionals maintain confidentiality and will help provide insights to behaviors and solutions that create a positive change. For CRNAs and students with addiction issues, an informal peer support group, which has existed for over 25 years, is Anesthetist in Recovery, also known as AIR. You'll find AIR information online at www.aanapeerassistance.com and among the resources for this module. As individuals, nurse anesthetists have a professional responsibility to look after their own and their colleagues' personal health and wellness. As a professional association, the AANA obligation is to ensure that its members are able to provide safe and effective medical care. This responsibility is promulgated in the AANA's practice standards and guidelines, which can be likened to a contract with the public to meet the highest standards of competence and ethical behavior. This personal and organizational obligation translates into different professional requirements. First, to promote health and wellness among practitioners, and second, to promote the appropriate mechanisms to A, detect any impairment, B, provide supportive intervention, and C, to refer and/or report impairment if necessary. In conclusion, we review our purpose and goals for this discussion of wellness. Self-care is an essential underpinning to best practice in the profession of anesthesia and to the community in which you live and work. Self-care is balancing our energies between work and play. It is awareness and recognition of needs, limits, and coping abilities. It is the capacity to meet challenges without fatigue, stress, illness, unhealthy behaviors, and destructive choices. The mutual well-being of individuals and organizations is essential in rapidly changing environments where sound decision-making is at a premium. Although elusive, well-being can be sustained by systematic and continuous efforts to review the challenges and selectively focus efforts toward professionalism. It requires us to take personal responsibility for ourselves, to develop coping techniques to accommodate our work environment, and to develop lifelong resilience and personal well-being that enhances the profession and patient care. In speaking about life in general, John Gardner, an American leader, activist, author, and reformer, defines the meaning of life. Meaning is not something you stumble across, like the answer to a riddle or the prize in a treasure hunt. Meaning is something you build into your life. You build it out of your own past, out of your affections and loyalties, out of your own talent and understanding, out of the things you believe in, out of the things and people you love, out of the values for which you are willing to sacrifice something. Define your values by asking yourself, what do I value most? And what will I be doing in 5 to 10 years? Always strive for balance among the 7 dimensions of wellness: physical, emotional, intellectual, environmental, social, occupational, and spiritual. An imbalance between personal and professional life impacts lives daily through failed marriages, restlessness at home, inability to connect with one's family, especially children, inability to relax with free time, etc. We focus so much on the professional practice aspect of our lives, we forget to exist outside our careers. Dealing with the stressors of everyday life can bring one closer to the ultimate goal on the wellness continuum, a vital, meaningful, and satisfying life. Before completing this module, we invite you to spend the next 10 minutes or so using the elements listed in the previous slides to fill in the worksheet for a balanced life. This worksheet is intended to increase your awareness of positive changes for your contemplation, and perhaps plan for actions to build a sustainable personal wellness plan. We wish you the best in your journey toward a well-balanced life. To access the worksheet for a balanced life, click on the Resources tab for this module. It is also available online at www.aanawellness.com.
We hope the content from the Wellness and Chemical Dependency in the Nurse Anesthesia Profession curriculum modules will help each of you care for yourself as well as your patients. When you complete the curriculum, you'll find an increased knowledge of the occupational risk of chemical dependency in anesthesia professionals. The curriculum is designed to encourage you to build the ability to cope with stressors and to recognize the signs and behavior of an impaired colleague, as well as resources to find the available peer assistance when needed. The AANA provides supportive and supplementary information to this curriculum online. Go to www.aanawellness.com and follow the link for wellness, education, and research.